when the first patient was actually diagnosed, I still remember it was a late Saturday. That Sunday morning, we mobilized. We mobilized in regards to, okay, right now we need to call all of our partners that were organizing like the Lunar New Year and cancel. And then after that, looking at what happened in Asia, we started purchasing certain items that we knew we did not want our seniors out there to have to be exposed not only to the virus, but also we anticipate the discrimination and the backlash. So we ordered toilet paper, we ordered the oximeters, we ordered so many items because we wanted to make sure our seniors, number one, had the essentials, and number two, understood that there was somebody out there who was caring for them. When COVID-19 first hit, I still remember that first Sunday, when the Saturday was when they had their first confirmed patient in Orange County. So Sunday, our senior volunteers, those leaders, they had called, and we were asking them what's going on. Because like I said, they were already aware of COVID-19. Lots of people are panicking because they all want to cancel their medical appointments. And these seniors, lots of them have chronic disease. The chronic disease, you need to make sure that you're connected with your provider, right? And so with that said, we were already prepared because we also were in touch with those providers, and they told us, we switched to telehealth. Telehealth for them, that means if you have a computer, if you have internet access, you can have face-to-face with your doctor. So, we hear in the news across the country within Orange County, physical attacks, right? People getting hurt, people getting beat up. Most recently, an elderly man who was physically attacked on the bus, right? And then there are people who are being verbally attacked, right? And then there are those who read the news or read chats, and they're actually very hurt by what they read. Because for some of them, I can say it's sort of a wake-up call in terms of they didn't realize how much hate there was, and they didn't realize that it would affect them. When you're younger, your parents, of course, your choices in life, you're either going to become a doctor, a lawyer, or an engineer. And then when you get a little older, okay, a pharmacy. You can be a pharmacist. That might be a good choice. And from my background, my mom studied business, my dad studied chemistry, that essentially your choices, if you were going to follow them, might be what you consider a little limited. But once I hit college, actually, I think they were just a bit more relaxed in terms of, okay, now you're an adult, because technically when you go to college, you're an adult, that they were a bit more flexible. And so there's definitely potential in whatever field that you choose. You can make money, but you also have to make a choice in terms of, what effect you're going to have in making a positive impact in the community. And so I decided to switch my major to Asian American Studies, and then I was also policy minor. And then with that, I was exposed to lots of urban planning classes. And so when it was time to apply for graduate school, I applied for urban planning. And that just really opened my eyes to what interdisciplinary means. And so I think that what I really want the next generation to learn is not everybody's going to have to know how to speak Mandarin or Chinese or whatever, second language it may be. You need to learn more about the cultural language. The cultural language in terms of their actions really are really conveying how they really feel, from what they say with their eyes, what they say with their body language. You need to be able to read that. And like I said, what I do here, we wouldn't exist if there wasn't that need.